Welcome back to Blueprint to Heal. I'm really thrilled to have Dr. Sherri Tenpenny today. I have been following you, Dr. Tenpenny, for over a decade. And before we get started, I just want to mention that you've been in practice for almost 30 years,
Um,
as in more than that.
more
Okay. On the website, it says 96. So, okay.
than
Um,
that is when I opened my clinic in Cleveland. I've been in medicine since 1985.
Wow. Okay. So thank you for correcting me on that. And, one of the things I noticed going to your website is that you offer a lot of different, quote, alternative therapies. You are an integrative health center, which is one of the things I love. There is no one size fits all, as you know, in practice. And you've written numerous books. You have a whole educational program. You're on podcasts. You have your own podcast. And your handle, Dr. Busy T, really suits you for you have that on X and Instagram. So, anyway, thank you for being here today. I
Thank
can't.
you so much for asking me. That's great. Thank you so much for having me.
So, originally, I wanted to just dive deep into talking about heart disease. It is the number one killer in women, and different things like statins, and get your opinion on that. But with this bird flu craziness going on, I thought we should touch on that first. Tell me what your thoughts are. Is it something that we have to fear? And if you get it, what kind of treatments would you recommend?
It's just the flu. I mean, it's just the flu. I would think that 100% of Americans nowadays would be wise enough to know over the last 5 years, the government has lied to us, lied to us, lied to us, and they've weaponized things against us. And that the people would say, bird flu has actually been around since the 1900s. There have been several epidemics of H5N1. The biggest one in the country was in 2005 with the bird flu pandemic that I wrote a book at the time called Foul Bird Flu, It's Not What You Think. And then I have a new book that is coming out just in the middle of March. It's called Zero Accountability in a Failed System: How Big Pharma weaponizes vaccines, public health, and the law. And there's a big section in there about the nonsense of bird flu. So if people are getting hyped up about this and going back to wearing masks that do nothing except make the person who wears them sick, having, fear and hand sanitizers on everything, getting on airplanes and using those alcohol swabs and making the whole airplane stink of alcohol, that more people are getting toxic from the alcohol swabs than they are from anything floating in the air in an airplane. I mean, I think it's time for people to stand up and say enough is enough. We're not going to fall for bird flu, monkeypox, Marburg, polio, any of this nonsense. It's just time to tell the government to sit down and shut up. We're not listening to any of this anymore. We're not going to do vaccines, and the thing that we can do to keep our health, and we've known this even about the flu for 50 years. The best thing you can do to prevent from getting the flu is to wash your hands.
Right.
And when your hands been around your face or something like that, wash your hands. Um, Wash your hands, but not obsessively. Don't get OCD about it. Take vitamin D, 5,000 units a day. Take vitamin C, 3,000 milligrams a day. Take a little bit of zinc, like 10 milligrams a day to support your immune system. Take some quercetin because that is a plant-based product that really helps to support your immune system, and go about your life. I said at the very beginning of COVID, which, believe it or not, was 5 years ago this month, and we're still talking about it incessantly. And it's been 5 years. And what I said at the very beginning of COVID, like in March or April of 2020, I have the absolute 100% cure for COVID. Turn off your television.
Right.
It
I
will
know.
cure everything. And if people just went about their business and didn't wear a mask and didn't do the nonsensical social distancing, didn't get their nose crammed with a Q-tip every time they turned around, and the fraud of the PCR testing, and didn't get jabbed with those poison bioweapons, we would not be in the mess that we're in today from a healthcare system.
So, have you gotten COVID or something like COVID since this whole, you know, pandemic started?
I may have had a cold, which is what the vast majority of people that got COVID, it's like, oh, I'm sneezing. I better go get tested. Nonsense. Stop it.
Yeah.
You know, and so, just most people got either like a head cold, like mild cold-like symptoms. Some people got more like a cough and bronchitis. If they were more susceptible, they may have gotten pneumonia. But that's no different than regular flu. That's
Right.
no different than regular viruses. So we created this fear-based paradigm around the concept of the COVID, and it's just time to let it go.
And I think one of the big problems that we have, at least in the United States, is we have forgotten what natural immunity means. We have forgotten that we have an innate immune system that, if you treat it properly, will be trained to fight off various illnesses, even flus. I've never gotten a flu shot. I definitely did not even consider getting the COVID shot. And I've had maybe the flu once or twice in my entire life, and I'm 66 years old. To me, I guess as a chiropractor, I've been trained to say, you know what, it's okay to get these illnesses because it trains your immune system to get stronger. And if we just always try to take a medication or vaccines, that could be harming our immune system. So I think it's all, the other piece is we've forgotten to listen to our intuition too. We've been so trained to just listen to whatever the government official tells us to and follow along rather than just sitting back and saying, wait a minute, what does my intuition tell me? Is this really a good thing to do? So I appreciate you being one of the voices who's been speaking out about this from the very beginning. And I know I want to use the word brave, but I think that probably in your thought process, you are not thinking about if something is brave. My guess is you just feel it's the right thing to do to just speak out. And
Yeah, for sure. It's like, it's just, I mean, when you pull back the curtain and you see the little man hiding behind the curtain pulling the strings, and you see it clearly. It's my duty and God-given task to warn people. I've said sometimes I've talked a lot over the last couple of years. My Substack it's called Tenpenny Walk with God .substack.com that I do on Sunday, and I wrote this book, Walking with God, as a testimonial, inspirational book for people. And, on the stage, starting in 2023, I said to the Lord, I said, what do you want me to talk about this year? I'm really sick of talking about COVID. I've been talking about COVID in 20, 21, 22. What do you want me to talk about this year? And clearly I heard him say in my spirit, tell people to repent. So we did a lot of repentance work on big stages, and I took a lot of heat for that. And I didn't care because that's what God told me to do. And so sometimes I not so kiddingly refer to myself as a cross between John the Baptist and and Paul Revere, John the Baptist. Tell people to repent. You know, tell people to repent because the time of the Lord is coming. Is near. So, my job is to tell people to not fear these things, to support your immune system, to not be injected with foreign matter, to not allow when Paul Revere was saying the British are coming, not to allow our government or any other government or any other body like the World Economic Forum of unelected bureaucrats. Don't let them tell you what to do. It's time for Americans to re-engage with what it means to be an American. When you think back, 260 years ago, when all those people left the UK because of religious persecution and the quest for freedom, and they came across the Atlantic Ocean in those tiny little rickety boats. And then they colonized the East Coast, and then they went all the way across this 3,000-mile country and set up homesteads and did things all the way across the country. That was bravery. That was bravery. I read a book quite a few years ago now. It was called Westward the Women. And one of the things it talked about in the book is that from the time that everybody in the Conestoga wagons got to St. Louis, they dumped off all of their heavy armoires and all that stuff, in St. Louis that they had dragged across from the East Coast. And they went very lightly all the way into the West Coast. And then they would set up these homes in various places, and their husbands were frequently killed by Indians or killed by wild animals, and they were left alone raising children. And this book was told these whole stories because they found letters and stuff from women in the 1800s, and that the number one cause of death for women during that period of time was suicide from being alone.
Wow.
And so that was bravery. That was bravery to go, 1,000 miles away with no guarantees of food, shelter, security. If your husband was going to run off to try to, shoot a buffalo for dinner and never came back, I mean, that was bravery. What I do is just telling people to stand up and have courage and be brave again.
And the reason why I brought up the word brave is I know that as a medical professional, you risk your license by going outside of the norm. And you put that all on the line by speaking out, where you probably know a lot of colleagues that maybe have the same information, but were fearful of speaking out. But you just you plowed forward. You said, I'm not going to let anything stop me. And it's really something to be commended because again, in this time that we live in, and I'll give you a great example. A friend of mine 25 years ago got diagnosed with very aggressive cancer. And he was told if he did not follow their exact regimen, which was heavy duty chemo, heavy duty radiation, they actually only gave him a 30% chance of survival anyway. And he wound up going to Germany where he could follow more nutrition and did some radiation. And you know what? He came back to this country, cancer free. He couldn't find a doctor to manage his case because he did not follow the prescribed regimen. So that's why what I'm saying. And the doctors admitted, they said, look, if we don't follow this protocol, then we could risk our license. So, again, I know that this happens in medicine, and it's kind of like they want everybody to be this one size fits all, and it's got to be pharmaceuticals, and it's got to be tough as a practitioner now because it certainly wasn't that way 30 years ago.
Well, you're right about that. It wasn't that way 30 years ago, but really, um, becoming a physician is like, you know, it's like being part of a herd. And years ago, this was a long time ago, I heard Carolyn Mace give a talk on what it meant to become a physician. And she said it was akin to becoming a member of a street gang, that you had to fight your way in. You had to fight your way in. You had to, competition and MCATs and, get good grades and, all these other things. You fought your way into the system. Then you were there for 4 years and you got beat up like when you did rotations and, stuff. It was a very unpleasant experience. You had sleep deprivation, when they sleep deprive you and they indoctrinate you, that's part of medical education. And then you graduate and they hang a stethoscope around your neck and they put the little thing around your back and give you your diploma. And now you're in the club. You're in the tribe. Now try to leave. They will kill you on the way out, just like a street gang member, which means kill you, maybe not physically, but by reputation, by challenging your license, by disparaging your name, by saying that you're a tinfoil hat conspiracy theorist. They'll do all those sorts of things. And she gave an analogy that I thought was really interesting. She said, think about it as like a herd of buffalo. I've never forgotten this. She said, think about a herd of water buffalo. They all kind of go lockstep in unison. And what happens to the one little water buffalo that runs away, that says, I don't want to be part of that anymore. They want to go over there. They get eaten by the lion.
Right.
And so that's kind of what happens in healthcare and with doctors, that doctors are part of the club and they get paid a lot of money. And most physicians now are no longer independent practitioners. They are a W-2 employee that work for a big hospital system. So they have a boss. Unlike me, I have my own practice, and so I'm my own boss, like it used to be 30 years ago. But most physicians now their offices belong to a part of a big healthcare system, for billing and insurance and Medicare and Medicaid and all these different things. And the hospitals bought up all these doctors' offices saying, "Oh, we'll take care of the billing for you. We'll even pay your employees for you. All you have to do is come in, punch a clock, and see patients." So now they are W-2 employees, which means if you're an employee and you disagree with your boss, or you think that what your boss is doing isn't such a good thing, or you want to tell your you want to tell your patients about CoQ10 for heart disease, or you want to talk about diet and nutrition, and your boss says, no, you're going to prescribe statins, you're going to prescribe these things, you're going to order a heart catheterization, you're going to do treadmill testing, you're going to do all these different things. And the more of these you do, the bigger your bonus is going to be on a quarterly basis. What are you going to do? You're going to do what the boss tells you because it puts more money in your pocket. I use this analogy sometimes that's saying that if you worked for Dunkin' Donuts, and say you were an employee and you worked at Dunkin' Donuts, and every day, the people will come in, they'll get their coffee and they'll get their box of donuts. And as they come to you as the cashier, where you check them out, and you said, those donuts really aren't very good for you. That white sugar is really bad and they increase your cholesterol and they've got trans fats and they just provide empty calories. And I know they taste really good, but they're not good for you. How long do you think your boss would keep you? Not very long. The same has happened to physicians. Once you stand up and step out of the conventional paradigm of vaccination, doing blood tests, x-rays, doing procedures, and all these things that generate more money, you're not thought of very kindly, and you take a hit in your pocketbook first, and then you take a hit in your reputation second.
Well, and also for someone that's carrying a large student loan debt, it's not
Mhm.
like they can say, oh, well, I'll just go out and start my own practice because that debt is huge. It's probably 250 to $300,000.
400 is the average these
400.
days.
Yeah, for chiropractic, I've heard, 150 to 250. So that makes sense. It would be a lot more. So, I feel like they're kind of stuck. And also, and this is just my impression. I was part of the medical system as a patient the first 29 years of my life. I was constantly on antibiotics and steroids, and it destroyed my gut. I developed food allergies, IBS, you name it. I developed a lot of health problems. And at the age of 29, I started chiropractic care and I was able to get off everything. It just my health returned. So like I've never had a mammogram, I've never had a colonoscopy, just because I feel like they're very invasive and I worry about the X-ray radiation. But it feels to me like when you're going through school, you mentioned about the sleep deprivation, it takes away the ability for a doctor to think critically if they're just being told what to think. And
Mhm.
then they have the pharma reps coming into their office and telling them about the latest and greatest drug. And this is my assumption, and please correct me if I'm wrong, but I feel like it's not a great foundation for thinking on your own.
It's true. I mean, and I even think that nowadays that the selection process for getting people into medical school, part of that selection process, even though it may not be said, overtly, part of the selection process is, are you an independent thinker or are you going to go with the program? And if you're an independent thinker, you tend to be a rabble rouser, like I challenge everything, I question everything. You're probably not, if there's your competent, ability to get into medical school will probably go down a bit. Now,
Right.
that isn't anything anybody's going to say overtly, but they don't want those kind of people in medicine anymore. And I've said for a long time, the last of the thinking doctors died in the 1940s. And these were the doctors that, would go, huh, look at that. Never seen that before. And they would pull out their anatomy, physiology, and biochemistry textbooks from school and try to figure it out. And then they would write in the British Medical Journal, when it first started back in the 1800s, was a communique between physicians saying, I saw this. Has anybody else seen anything like this? I've never seen this. The best I can figure out from my physiology textbook is I think this is this. And this is what I've done for it. Anybody else seen that? Or they've said, I found something really unusual and I treated 10 people and they all got better. You guys all seeing something like this? And that was where the Lancet and the British Medical Journal first started from, was a communique from thinking doctors that hadn't, was like, huh, what is this? And now that we know that, all the vaccinations from early on, I could go through the whole schedule. The more vaccines that people got, the more likely they were to get hypertension, the more likely they were to get heart disease, the more likely they were to get cancer, and on and on. And so, but physicians don't think like that anymore. They think symptom pill, symptom pill, symptom pill, symptom pill, and all they practice, for the majority of them, not all, but most of them practice suppressive medicine. That if we are symptom free in the presence of a pharmaceutical, that's what we now call health. And it's not true.
And I have to wonder how many of the prescriptions, how many prescription drugs somebody's taking is for symptoms from other prescription drugs, right? And I'll give you a great example. I had this nurse come in as a patient many years ago. She was in her early 50s. She was on 16 different medications. Now, she didn't take all of those every day, but she took a lot of them, and some of them was, as needed. And I was able to trace it back to the very first medication she was put on, and it was a statin drug. So she was put on the statin drug. It caused other symptoms. She was put on other, medications, and it became a cascading effect. And, I'm really glad we're having this conversation because most people aren't aware that chronic disease, affects about 60% of Americans. And heart disease, as I mentioned, is number one in this country. And if the medical profession had figured it out, I think, and was thinking critically and taking every person as an individual, we probably wouldn't see those numbers. And I want people who are listening that maybe aren't aware of you, Dr. Tenpenny, and aren't aware of, alternative or holistic health, how, it's important to have all this information when making the decision rather than just keep going down that, okay, I'm having this symptom, I'm going to take this drug. And, I want to really talk about heart disease because, as I said, it is the number one killer of women. It's the number one killer, period, of adults. And if somebody were coming to you and they were diagnosed with heart disease, what would be your blueprint? Even though, again, I understand it's not a one size fits all, but where would you start to look at that person to help them?
Diet and then diet and then diet. And then after that, diet. So because the most of the reason that people get metabolic syndrome and they end up with insulin resistance and elevated blood pressure is diet. It's the trans fats, it's the seed oils, it's white sugar, I call it the great whites. The first thing we do is we remove the great whites from your diet, which is white sugar, white refined sugar, white flour, white rice, which is just empty calories, and homogenized refined cow's milk. We take all of those out first because they're all pro-inflammatory and they do nothing for nutrition in your body and they just cause inflammation, which is the core source of every disease is inflammation. And then the body does what it does to try to compensate for the inflammation. So we start with diet. Look at the best diet I think that everybody can do because there's so many trendy fatty diets. But the one is I follow with which comes from the American Academy of Lifestyle Medicine, which is eat real food. What comes in a can, a box, or they hand you out a window isn't real food. Eat real food. Eat mostly fruits and vegetables. Eat as much organic as you can find and you can afford. Eat real meat that you know who the rancher is and you know where that came from. And don't eat so much. Eat
Right.
smaller portions. There's a trick in dieting if you're trying to lose weight, is to instead of eating your dinner on a dinner plate, eat it on a salad plate. And don't go back for 5 helpings. Eat it on a salad plate when you're not eating so much. And then, of course, there's the things like exercise and sleep and water and, all that sort of stuff. But in terms of food, you want to keep, you want to have anti-inflammatory foods. A lot of blueberries are really important and really important to take out the seed oils, the soybean oil, the canola oil, all these things. And I just had on my podcast for our membership, we have a membership, it's called Tenpenny Prime. And we do offer 3 benefits to our Tenpenny Prime membership. Number one, the second Wednesday of the month is a white paper, is a long white paper that I write on a topic. And then the third week of the month is a recorded presentation on a topic. And I just did a recorded presentation for our members on cholesterol, the good guy. And then the last Wednesday night of the month is a live presentation it's called Ask the Expert. And for February, I had on Dr. Asim Malhotra. And if people don't know who Asim is, he's sort of like the Peter McCullough equivalent from the UK. He's a really cool guy. He's really has made a difference on the scene. And one of his key things that he talked about is if you eat anything that is a processed food that has more than 5 ingredients in it, don't eat it. If you
Right.
look at the label, more than 5 ingredients because all the stuff in there is not real food. It's food dyes, it's preservatives, it's pro-inflammation, it's seed oils, it's all kinds of stuff. So and it's really hard. I mean, so I for the past year and a half, I've been personally much more conscious about reading food labels. And I'll tell you, probably 9 out of 10 things that I pick up, I put back on the shelf. 'Cause I don't want to eat that stuff. I don't eat that garbage. So when I start with heart disease, start with diet, diet, diet. That's the most important thing that will make you lose weight naturally. It will take out the inflammation. It would improve your heart disease. I mean, he has a program, I think it's called metabolic reset.co is his program that he's been using this now to eliminate heart disease, eliminate high blood pressure, to eliminate metabolic disease. It's like a 5-week program, and you can do it all online. There's a community online for that. It's metabolicreset.co. And I'm not an affiliate or anything for it. I just think that the program is really super good. And it's all about change. You can correct heart disease by diet. And he said that, he was trained as an invasive cardiologist, which means that he put in stents, he did, bypass, he did angiograms, he did angioplasties, he did all those sorts of things. He said, I don't do any of that stuff anymore. None of it's necessary.
Right. And I do want to talk about statins for a minute too. I think it was about 20 years ago, I was at a energy healing training, and at lunchtime I sat next to this doctor. I didn't know he was a doctor. He was formerly a plastic surgeon that just kind of said, you know what, I've had enough. I want to do something that's really making a difference. And he was telling me about the history of statin drugs. And please, correct me if I'm wrong, but he said that when the person who invented the statin drug took it to all these drug companies, they said, well, it's kind of like a useless drug. Like, what point is having this drug when cholesterol isn't an issue? We need cholesterol for our brain, for our cells. Cholesterol's in every cell of the body. And finally, somebody bought it, and now I think it's like the number one prescribed drug in the US. And, I want to talk about the importance of cholesterol in the body and how detrimental, taking a statin drug can be for somebody.
Yeah, that I know the person who developed that drug. I know him personally. And that really is true. And then really what the drug was designed to be after everybody was like, why do we want to do this with cholesterol? Cholesterol is a good guy. We need cholesterol for our brain, for our nervous system, for all sorts of things for our cells. And so it was actually designed to be an orphan drug. And for people that don't know what an orphan drug is, it's like a specialized drug for a specialized problem. And so it was designed for people that had genetic abnormalities in the metabolism of their cholesterol and triglycerides, that even with diet, exercise, or whatever, their cholesterols were in the 600 range, which really is too much. And so it was really just meant for that small subset of a population that has a genetic abnormality with elevated cholesterol. And that was what it was really designed for. And then somebody in Avenue said, "Well, we could make this work." And off to the races they were. Because cholesterol is not a bad guy. It's a good guy. In fact, if you the main reason, the main thing that cholesterol is good for is your brain. Your brain, if you cut off the top of your head and scooped out your brain and put it on a scale, 80% of the dry weight of your brain is made of cholesterol. And even though cholesterol is only about 2% of your overall body weight, it has 80% of cholesterol and uses 80% of the dietary cholesterol that comes in, because the cholesterol has to be there to make the electrical circuits between the neurons connect. And it goes down all of it creates the myelin sheath, which goes down all of the nerves in all of your body, and if you cut the myelin sheath, you don't get the electrical stimulation. And it's really important for that. It's important for your hormones. It's the base molecule of estrogen, progesterone, and testosterone. It's the starting molecule. It goes through 23 different processes from cholesterol to become vitamin D. And so it's important for your body to make vitamin D, which is then activated by your kidneys, and then it goes to your skin, to where it's really the final activation happens when it's irradiated by natural sunlight. And so it's really, really an important molecule in our body. And I remember years ago, I went to a conference and they were really promoting statins at that conference. And I remember the cardiologist saying, cholesterol is so bad. I wish my cholesterol level was zero. And I've never forgotten that. And I thought, this guy is a speaker and he's a cardiologist. He needs to go back to medical school.
Right,
So cholesterol is not a bad guy. It's a good guy. You need it for hormones, for your brain, for your nerves, for your vitamin D. It's really, really important. And it is not, and it's the cholesterol that gets transformed and scuffed up on the edges by pro-inflammatory things like seed oils and white refined sugar that makes it start to get sticky. And so it's really made sticky by our diet. It's not intrinsically sticky because our liver happens to make it.
right. And the other thing I think that's very important is to understand, and anyone who's taking any kind of medication, always go online, do the research, side effects. Um, so two of the biggest side effects of statin drugs are memory loss and confusion. And, I think, again, this is me just talking. I think a big problem that we have with dementia in this country could be traced back to statin drug use. As we talked about, it is the number one prescribed drug. It seems like the dementia numbers are getting bigger. We see all these memory care facilities. And just as a personal experience, my mother, she died a year and a half ago, and she had dementia. And I didn't know she was on statin drugs for 25 years. She hid it from me. And
Oh,
she used to be sharp as a tack. I mean, my mom was incredible. She could talk not in depth about politics or, the stuff that you and I would probably want to talk about, but she was very intelligent. And, I watched her memory decline. And then once I figured out that she was on statin drugs, I went and talked to her doctor, and she had no history of heart disease. There's no reason to put her on this drug. And I finally convinced him to take her off because my mother was, her doctor was God. And even though I'm a chiropractor and a doctor, I'm not a real doctor, so she wasn't going to just take my word for it. But finally got her on board, finally got him on board. She got off the statin drugs. But the decline of her dementia or decline of her memory stopped at that point. It didn't get worse, but the damage was done, and what are your thoughts on that? Do you think that there might be a connection?
100%. And they've actually even documented that now. I mean, and there's books written about that. And there's people that have TIAs and people that have short-term memory loss that never comes back after they're started on statins. And for those people that are listening that say, well, gosh, I'm on a statin. How do I know what a statin drug is? Well, Lipitor is the number one, one of the top two prescribed drugs in America. It's within the top 10. And so Lipitor is a really common one. Mevacor is another one. It's kind of an older one. There are lots of drugs that you just need to look them up. You just need to, go out to Google, type in what is, and put in the name of your drug. If you have to look at the spelling because you're looking at the pill bottle, then go ahead and do it and see what it is. And if your doctor is like really outrageous that you have to be on this statin drug because he's never read a single paper or read any stuff that's in medical literature or listening to just about anything. I mean, there's so much stuff, so many things that are out there right now that are um, really, really important that he needs to read. In fact, Dr. Asim was telling me that there's some of the newest information that's come out that says that people that are on long-term statins have less than 1% increased survival over people with the same cholesterol level that are on no statins. So it doesn't improve longevity. And if your doctor's really adamant about it, then you absolutely must take coenzyme Q10 with it. Coenzyme Q10 is the most important nutrient for your mitochondria, for your energy, and your heart has the highest concentration of mitochondria of any organ in your body. And what one of the things that statins do is it stops the production of CoQ10 intrinsically in your body. And after the age of 50, you absolutely need to take CoQ10 anyways because your body really doesn't make enough that you really need. And so between statins and age, you need to take coenzyme Q10. And coenzyme Q10 the best way to take it is as a gel cap. You should not, if you take it as a powder form, it's not an active enzyme and it really doesn't do anything to help you. And when it's in a multivitamin and it's in a powdered form or in a pill, in a tablet, all it does is drive up the cost of that multivitamin because coenzyme Q10 is a little challenging to manufacture and to keep it active. And so it's a little bit more expensive of a supplement than, say, vitamin C is. But you need to get it in a gel cap, and it's usually suspended with a little vitamin E oil. And anywhere from 100 to 300 milligrams a day, you should take just anyways, but you absolutely have to take it if you're going to take a statin. In fact, I've said for many years it should be malpractice. If you take a statin drug and you have a side effect like pain in your legs or a ruptured Achilles or dementia or a heart attack or whatever you have while you're on a statin and your doctor has not recommended for you to also be on coenzyme Q10 at the same time, that should be malpractice.
Yeah, I also discovered with my mom that so when we convinced the doctor to take her off the statin drug, again, it was a battle that went on for years. This was around the same time that her husband was dying of cancer. So her stress was through the roof. And, she died at the age of 91, so she was in her mid 80s when she's schlepping him to all these doctor's appointments, and her stress was through the roof. So I started working with her, doing some like guided meditation and working with her to reduce her stress, and her numbers started coming down. Her cholesterol numbers actually were going into the normal range just with doing some stress reduction. And he really challenged me because when we recheck our numbers in 3 months, I'm sure they'll still be high, and they weren't. So I think that, again, I hope that people that are listening to this will go to your website, look at all the articles that you've written, check out your Substack, and I'll list all that information in the show notes so that people can go to your website and learn and follow you on X and Instagram and all those great places that you're present, and listen to your podcast, because you are a walking wealth of information. You're like a walking library. I don't know how you have time to do everything. So, anyway, I want to thank you so much for coming on today. I really value you as a person, as a doctor, and I hope there's, people out there that will help start listening to their intuition and start doing their research.
Well, thank you so much for having me, Nancy. It's been a pleasure being it's a pleasure talking to your audience too.
Thank you.